October is ADHD Awareness Month. Attention deficit is no longer a condition associated with children, though. There's been a rise in diagnosis for kids, adults, and especially women.
Attention deficit is defined as a neurodevelopmental disorder that is the characterizations of persistent inattention and hyperactivity.
People with ADHD basically have different sort of brain development that causes problem with them being able to organize and plan and kind of execute the things that they have.
The doctor points out that a diagnosis before age 6 is ill-advised. While ADHD was thought to be more common in males, studies within the last 5 or 6 years show a very different trend.
ADHD in them can present very differently with more predominant symptoms of like inattention, difficulty like focusing, getting things done, not being able to stay on task, and not the same hyperactive features as we see in young boys. So at this time, we're basically questioning if that is even true. And I think ADHD in women is very underdiagnosed.
The doctor says be cautious of online surveys that diagnose ADHD. She says it doesn't take into consideration all the possible factors.
Houses that have had a lot of adverse childhood experiences, that can come out as irritability or being just like too distracted. And is that because they're feeling emotionally neglected, or do they have ADHD? So I think teasing out and making sure we're not missing other comorbid conditions is extremely important.
And medication is usually a last resort and not a cure. Doctor says she also looks at a person's diet.
Ultra-processed food, excess sugar, and some sort of like preservatives and dyes that have contributed to some level of ADHD dysfunction.
The doctor recommends seeing a physician if you do believe that you do have ADHD. Next month, by the way, will be the International Conference on ADHD. It'll be from the 13th to the 15th right here in Kansas City. You can register for your tickets on the ADHDconference.org website.